So my talk is on decreasing the time from broad-spectrum antibiotic coverage of blood cultures, positive blood cultures for Staphylococci to narrow spectrum. So my experience with CQIP really started with the assembly of a team, and the team, I was amazed at how quickly they assembled and all the support I got, and also the camaraderie and the collegiality and the sort of mixing with at the workshops with colleagues across the province that are also involved in QI. And really we stuck into there's a real science and methodology to QI that I just wasn't aware of, and I sat for years with senior management as a department head watching these driver diagrams and A3s being drawn up, thinking this was just something that administration did. But actually there is some science to it. So as my data started to come in, my graph of my data to this point is the dotted lines are to the prior to the institution of the testing, and then the last 7 data points you can see that with the solid lines. The red is the mean and the blue is the median. And at this point it appears that we have in fact improved that time from the initiation of broad-spectrum antibiotics to narrowing and targeted antimicrobial therapy. Some of the breakthroughs that I personally had was one that QI is not clinical research, and it's very doable, and it's just small numbers and small steps, and the cumulative effect of those small steps really leads to an improvement in QI, and the successes was that I could actually get this done as much as I could in the short time that I did. And there always is a resistance to change, and there was at least one person that commented, someone once said, why is an anesthesiologist doing this? Forgot that I was also an intensivist. But the other one was that one person said, well, what is the sensitivity and specificity of this? And so there always will be some resistance to change, and you just have to fight to work through that. I hope that I can continue on with this work. One, I need to learn to recognize where those areas of improvement can be and those small steps that I can take. And with that sort of working with colleagues, those things start to, and learning the principles, those things start to come to you, and a deeper understanding of you and use of the methods and the tools. And to do that by continuing on my personal, or not personal, but clinical work in this area, but also through coaching and teaching those who also want to learn this. Thank you.